Tonight, NCH Healthcare in Collier County is confirming that at least 4 radiologists have given notice they're going to leave the hospital. Thanks for sticking with us for 4 in Your Corner coverage at 6. I'm Patrick Nolan.
And I'm Jane Monreal. This comes on the heels of a controversial pilot program assigning hospitalist physicians in charge of patient care in certain units instead of personal doctors.
4 in Your Corner's Call 4 TA is talking to NCH and others in the medical community about how this upcoming departure of these radiologists could impact you, especially if you're an NCH patient.
We do have 4 upcoming departures within our radiology department.
NCH Director of Operations Sarah Fry says 4 of their radiologists have given their notice, but says they're already recruiting staff for the radiology department.
That's obviously is going to cripple the operations of the hospital until they can get those doctors replaced, and they're not easy to replace.
Former chair of NCH's Foundation Committee, Bob Stucker, says he thinks the hospital's controversial program of putting hospitalists in charge of patient care instead of personal physicians in certain units is having a negative ripple effect.
What I found from talking to these doctors and nurses and others, that management at the hospital has a very toxic style, has created a toxic culture.
It was for various personal reasons. So there's not one reason why one of the physicians is leaving, but we do wish them well.
She adds that patients shouldn't see any decline in patient care or services after the radiologists leave. But Ray Montecalvo, a radiologist who once worked with NCH, says radiologists are in short supply nationwide and thinks the ones that are leaving means a big blow to the hospital.
In order to build a strong sense of trust between radiologists and the clinicians, the other physicians who need them, you really do need to have a strong group on the ground.
In Naples, Carl Fortier, Fox 4, in your corner.
The folks at NCH are also telling Carl that they decided back in October to bring radiologists under NCH employment until new ones can be hired. Some scans, they say, will be read remotely by outside radiologists.